So let us start the practical. This is the sixth number of practical, and this is the first class that we have to perform in the lab. So this is very, very important, and try to listen it carefully so that you at least have to understand. So regarding this practical is concerned, the objective of the practical is compounding and dispensing of the ointment. So what is the meaning of compounding on and dispensing? These two terms are coming in the definition of pharmacy. So pharmacy is nothing. This is the collection, compounding, and dispensing of drug is called pharmacy. So here we have used two terms, compounding. So compounding is simply preparation or preparing of a medicinal drug or pharmacy preparation, and dispensing is after the preparation of a pharmacy preparation, we are labeling it as well as dispensing to a patient, giving to a patient. So we are going to start the preparation of the ointment. So this is the objective, compounding and dispensing of the ointment. So first we have to go through the definition. Regarding definition of ointment is concerned, the very easy way to recall the definition of ointment. In Hindi, the meaning of ointment is malham. So I think you all are gone through, you all have seen the ointment. So when you have seen the ointment, you have seen the texture, how it look, and on the basis of the texture, you have to define it. So which type of the texture you are finding the ointment? It is semi-solid in nature. So this is semi-solid medicinal preparation, and usually where you are applying the ointment on the skin or mucous membrane. So once you have seen the ointment, by looking the ointment and its use, you have to define the ointment is simply a pharmacy preparation, semi-solid pharmacy preparation or medicinal preparation that should be applied on the skin as well as the mucous membrane is called ointment. Then how we are applying it? Either without or with rubbing. So we are applying the friction, means rubbing, as well as without the rubbing. So you have to define ointment is the medicinal preparation, semi-solid in nature, apply on the skin or mucous membrane by or without friction is called ointment. And this is an external use preparation. So this is very, very important. Now we have to go through the usage. And I think you all have seen the ointment, so you must recall the usage also. So usage of ointment is the when you are applying any vehicle or the base present in the ointment, they are semi-solid in nature. So when you are applying it over the skin, you will find the softening at the site of area as well as soothing at the site of application. So ointment possessing softening and soothing effect at the site of application, and this is called emollient action. So what is emollient? Softening and soothing action of the ointment because of the presence of base or vehicle in that is called, this is one of the use or function of the ointment. Second, when you are applying over the skin, so it is protecting the wound. So it if another use is protective effect. So protective effect, emollient effect, and you are applying it over the skin, so topical application. So these three are the use of the ointment. Now we have to go through the different type of ointment. So ointment have to classify or typed based upon its penetration in the skin or based upon the presence of the base in the ointment, because base is usually going to decide the penetration of the drug. So the classification is of the ointment is based upon the presence of base or vehicle or its penetration over the skin is called is classified the ointment. So what is base or vehicle? This is nothing. This usually participating in the preparation of the of any ointment or any other medicinal preparation, and the base or vehicle is taking the major part, major component or maximum component in the medicinal preparation, as well as the base is making it in administrable form. So this is the importance of the base. Now we have to go through the type of the ointment. So there are three type of ointment based upon its penetration in the skin. If the ointment is not penetrating the skin or very meager amount, very meager penetrating power, very low penetrating power in the skin, or no penetration power of the ointment in the skin, each type of ointment we are calling it the epidermis or protective ointment. Why we are calling it the epidermic ointment? Because it is only acting on the surface of the skin. That is why we are calling it the epidermic or protective ointment. So it is mainly or only producing its action on the epidermis of the skin, and therefore it is called epidermic or protective ointment. And in this we are using the base, and the base are oleaginous nature. Oleaginous means oily type, and these bases are petroleum, waxes, and their combination. So these are the bases like petroleum and waxes, or in their combination we are using for the epidermic or protective ointment, and their action is mainly persisting over the epidermis of skin is called epidermic or protective ointment. The second one ointment is this ointment is somewhat more penetration, having more penetrating power than the epidermis, and that is going to penetrate the deeper layer of skin or the cutaneous tissue or up to the endodermis of the skin, and therefore because the drug is penetrating the skin or cutaneous tissue or in the deeper layer of the skin, therefore it is also called penetrating ointment on the basis of the penetration of the ointment in the endodermis or deeper layer of the cutaneous or the skin is called epidermic or penetrating ointment. In this, the bases that used are vegetable oil, then the lard, then the lanolin and hydrous lanolin, and their combination. This is about the bases used in this endodermic ointment. And the last under the classification of the type of the ointment is diadermic or absorption ointment. So why we are calling it the absorption ointment? Because the ointment is not going to not only penetrate the skin, I mean it will penetrate the skin as well as some amount of the ointment get absorbed, and therefore it produce systemic effect to very meager, not very high systemic absorption. So diadermic or absorptive type of ointment, the name absorptive ointment, because the absorption of the ointment occur, and because of the absorption of the ointment, this type of ointment is also producing systemic effect, and therefore it is also called diadermic or absorption ointment. And in this the base that we are using having the very good penetration in the skin. Now we have to go through the first we have gone through the types of the ointment. Now we have to go through a method of preparation of the ointment, how we are preparing the ointment. So this is called method of preparation of ointment. So method of preparation of ointment is also three type, like the type of the ointment, that the first one is the mechanical method. So name is clear cut indicating that in mechanical incorporation method of the preparation of ointment, we are applying the force. So that is why this is called mechanical incorporation method. So this mechanical incorporation method, in this we are applying or using the mortar and pestle, and in this mortar and pestle is used to reduce the size of the granules or the crystal by rubbing or by circulatory motion with the rubbing. So when we are reducing the size of crystal by applying the mechanical force only by rubbing, this is called, in that mortar and pestle, this is called trituration method. And when we are applying rubbing as well as the circular motion in the mortar and pestle to reduce the size of the crystal or the particle, is called grinding. So we are applying leviation or wet grinding in this under the method of preparation of the ointment under the mechanical incorporation method. So mechanical is the word used because we are applying the force. Now next method is the fusion method. So fusion method is nothing, when we are using the different type of bases or different type of vehicle, these bases or vehicle are possessing different type of melting point, and because of different melting point of different bases, you have to mix it together. So how you have to mix, because the melting point is different. Someone is very hard, someone is soft, someone is having higher melting point, someone is having lower melting point. So when the number of bases or vehicle with different melting point is more than one, then we have to mix it by a method by applying heat, and therefore these bases or vehicle get fused together, and that is because of the fusion of the different bases, we are calling it the fusion method. So in fusion method we are applying the heat to melt the bases from higher to lower melting point. So we are mixing the bases by applying the heat in water bath in decreasing order of their melting point to mix this mixing of the bases is called fusion method. And the last one under the preparation of ointment is method of preparation of ointment is chemical method. So in this chemical method, name is itself defining. In chemical method of ointment preparation, a chemical reaction occurred. So in chemical method of ointment preparation, a chemical reaction occurred, and because of this chemical reaction, there is formation of the some chemical occur, and it will help in the mixing of the different component of the ointment or the pharmacy preparation or the medicinal preparation. Take medicinal preparation. Take the example. Iodine is not very much mixed with the bases. So for mixing the iodine, we are using one component, potassium iodide. So first, what we are doing, potassium iodide is going to mix with the glycerin. So after trituration of the potassium iodide and therefore mixing with the glycerin, and after mixing with the glycerin, we are mixing in that iodine in case of iodine ointment. So a chemical reaction occur between the potassium iodide and iodine to form polyiodide. So what is polyiodide? Polyiodide is formed after the chemical reaction between the iodine and potassium iodide, and a component is formed, we are going to call it the polyiodide, and this polyiodide is very much mixed in the ointment when we are going to use the bases. So that is why this is called chemical method, because the chemical reaction is occurring, and third compound is chemical compound is formed, and which will help in the mixing of the different ingredient of the pharmacy preparation of the medicinal preparation. So this is about the method, the types, and the definition of ointment. Now we have to go through the preparation of the ointment. So first preparation of the ointment is compounding and dispensing of iodine ointment. So what is the name of the ointment? Iodine ointment. So that means कि this ointment have the base as well as also have the iodine. So the under component or the composition of the ointment, you never forget on based upon the name iodine ointment. So that is indicating iodine is present. And this is a ointment. So base or vehicle is present. So base and vehicle must be the there. So other component, what the other component is there? Potassium iodide is there. That I already discussed. Potassium iodide is going to form the polyiodide of iodine, and which will help the mixing of the or formation of the iodine ointment. So therefore the third component is the potassium iodide, and the fourth the component we are using the glycerin. So glycerin is helping in the formation of chemical reaction between the iodine and potassium iodide. So there are four ingredients of the iodine ointment, that are iodine, potassium iodide, glycerin, and the base is soft paraffin, white soft paraffin. For 100 gram, the iodine is 4%, that is 4 gram. Likewise, potassium iodide is also 4 gram, and the glycerin, that is 12 ml, and the last one, the remaining part, 400 gram, is made by the base or vehicle, that is the 80 gram. This is 20 gram is coming, about 20 gram is coming. So 80 gram is by the soft paraffin, white soft paraffin. So how we have to go through the ointment preparation, iodine ointment preparation? For that, we have to go through the procedure of ointment preparation. So under the procedure of the ointment preparation, we have to go through the method to prepare the ointment. So in this method of the ointment preparation, we are going either through the mechanical incorporation method or fusion method, as well as the chemical method. So the method that we are used for the preparation of ointment method are mechanical and chemical method, or you can say the fusion and chemical method. So how we have to proceed? We have to take the potassium iodide, we have to take the iodine ointment as per the weight as per the after weighing, and thereafter we have to grind it in the mortar and pestle. After the grinding, we have to mix the glycerin with the potassium, measure the glycerin in the measuring cylinder, and thereafter we are going to mix with the potassium iodide. So glycerin and potassium iodide get mixed together. After that, the third component we are adding is the iodine. So iodine, after its trituration, we are mixing in the glycerin potassium iodide mixture. So therefore it form in the mortar and pestle, and therefore it form the polyiodide. So what is polyiodide? Polyiodide is nothing. This is the compound formed by the potassium iodide and iodine. So we are going to write like this: potassium iodide and potassium iodide and iodine. This is called polyiodide. So this is formed between this is polyiodide, whether one iodine, two iodine, or three iodine, that we have to write here. So after mixing with the potassium iodide and glycerin, thereafter we are mixing with the iodine, and properly mixing of these three chemical, we have to weigh the final component, that is the base or the vehicle, and we have to melt it at the 40 degree centigrade. And after melting it, we are going to mix by fusion method, because you have melted it, so you have to apply fusion method and you have to pour these all bases in mortar and pestle, and mix it properly in mortar and pestle, and it will form a color of the iodine, and this made a iodine ointment. So this is all about the iodine ointment, preparation of the iodine ointment. So once you have prepared it, pack it in the butter paper, and wrapped it and used for the purpose, therapeutic purpose. So what is the use of this iodine ointment? Because iodine is a irritant, so and antiseptic, and also parasiticide. So main action of the iodine is the irritant action. So iodine is an irritant, so we are applying it on the irritation or the inflammation. So if you are applying anything that is irritant in nature over the inflammation, we are calling it the counter irritant action. So we are using iodine ointment as a counter irritant, where we are using where we are using it, where there is inflammatory product is present because of the inflammation, where the edema is present because of inflammation, then the rheumatism, that is the joint pain, arthritis, then the bony growth because of the inflammation, then the inflammation of the synovial membrane. So in these places we have to apply the iodine ointment to cure the irritation, because the iodine is going to produce mild persistent irritation, and therefore it will helps to remove the edema, helps to remove the joint pain, helps to remove the rheumatism, helps to remove the synovitis, also act as a parasiticide or the antifungal. Then the second and the last preparation is, this is the number 2. We are going to prepare the compounding and preparation of the red mercuric iodine ointment. So second preparation is red mercuric iodine ointment. So name is itself telling what is the name of the component is mercuric iodide. So we are using mercuric iodide. So here we are using mercuric iodide SgI2. So that is why the name of the preparation is a mercuric iodide ointment. So mercuric iodide ointment. So for that we are using mercuric iodide, that is the +2, and plus base. So main component is mercuric iodide and because its color is red, so we are calling it the red mercuric iodine ointment. In this, the component is red mercuric iodide. So this is AgI2 is the red mercuric iodide, and we are making it ointment. So the name of the ointment is the red mercuric iodide ointment or iodine ointment. Better to call iodide ointment. So we are preparing the 36 gram of the red iodide of mercury ointment. For the preparation of 36 gram of red mercuric iodide ointment, in this main constituent is the mercuric iodide. Here we are taking the 4 gram of the red iodide of mercury, and the remaining part is divided into two parts, and that are the base. So here we are using the base of two different melting point, that is lanolin and soft paraffin, 16 and 16 gram, and 4 gram the main constituent red iodide of mercury, that is the AgI2. So method of preparation, procedure for ointment preparation is the same as the iodine ointment. Either you have to apply mechanical incorporation method and chemical method, or you have to apply fusion method and the fusion method, not the chemical method we are applying here. Why? Because there is no chemical reaction occur. So only mechanical incorporation method, or you have to call it the fusion method. Here is no chemical method because there is no more than one chemical is present there. So there is no chemical method is applied. So lanolin and soft paraffin, we are mixing it by the fusion method by melting it, and thereafter, after the triturating the red iodide of mercury, we are mixing it by fusion method, and this get prepared the ointment, and now we have to go through the use of the ointment. So because this is also red iodide of mercury or red iodine of mercury is irritant in nature, so similar to the ointment we are using it as a parasiticide, as a counter irritant. So where the irritation is there in the affected animal, we have to apply there to counteract the irritation. And because of the irritation, at the neck region of the animal form the yolk tumor in cattle, so we have to apply there to remove the irritation. We have to apply there. Also at the joint region there is swelling, so we are calling it the bursal enlargement, particularly in case of horse. So their inflammation is there, so we are going to apply the counter irritant, that is the red iodide of mercury. And we are also going to mature the abscess, because irritant is going to produce inflammation, and that inflammation is going to help to mature the abscess, and once it get mature you have to apply the surgery. And also it is also used for the destroying the wall of the fistula and the sinuses. So as a rubefacient, so what is the rubefacient? Those agents that are producing the inflammation, and at the site of the application produce red color. So that is why they call the rubefacient. So what is rubefacient? Rubefacient are the agent possessing the irritant property, and when you are applying at the site of its application produce inflammation and increase blood circulation, produce red color, and this is called rubefacient. So we are going to apply the swelling around the tendon, ligament, joint, indurated glands, and mammatitis. So these are the use of the red iodine of mercury. So this is all about the practical class we have to perform in the lab.